Hello all the beautiful people, it's K-Day. This is our KYJ series and today's the letter K. So our first K word is going to be ketones. Ketones are one of those things that we hear a lot in clinical practice and clinical medicine. Ketones are the breakdown byproduct or product of the breakdown of fat. So how it normally works is that we release fat from our adipocytes, our adipose tissue, our fat cells, and that fat is released as free fatty acids into the bloodstream. Those free fatty acids are carried in lipoproteins back to the liver, where originally they were probably manufactured. And then they undergo a process called beta oxidization, and it's in that process called beta oxidization that the free fatty acids are converted into three different ketone bodies. Those ketones are called beta hydroxybutyric acid, BHB, acetylacetate, and acetone, and the other three ketones. Acetone isn't really terribly helpful. We just breathe that off, and that's why when somebody is in a state of ketosis or ketoacidosis, you might smell the acetone coming out of their breath. Acetylacetate you can test in urine, so if you were to dipstick somebody's urine, you might test positive for ketones. But beta hydroxybutyric acid, or BHB, that's actually useful as fuel, and that enters quite freely into cells, where it ultimately goes through chemical change and turns into acetyl-CoA and enters the Krebs cycle, and voila, energy, ATP. So, ketones, that's our first K word. What about vitamin K? That's an important K. Vitamin K, not to be confused with K, which is potassium, which we'll also do a bit later, but vitamin K. Vitamin K we get as a precursor in our diet. Sort of leafy green vegetables are full of vitamin K. And when we digest that vitamin K, it goes down into our gut, and our normal flora in our gut actually sort of extracts that vitamin K from fibrous material, where it goes to the liver, and the liver uses it to manufacture a number of our coagulation proteins, particularly factor 10, Stewart-Prower factor. And factor 10, as you'll recall from your coagulation pathway learnings, is the sort of the first step in the common coagulation pathway. So factor 10 is absolutely essential. Some medications block vitamin K, and so warfarin is sort of the example there. So warfarin is a vitamin K antagonist, but ironically, if somebody's on warfarin and we needed to reverse their warfarin, we give them vitamin K. So they're sort of like each other's antidote, vitamin K. A deficit of vitamin K actually causes bleeding. We often have to give it to newborn babies because newborn babies are born with a sterile gut. They can't convert the vitamin K in their diet into vitamin K that's useful in their liver, so we give them a little boost in life so that they don't bleed. Vitamin K. Okay, so let's do K. K. Okay, oxygen, potassium. No, K, just K. Potassium. It's called K because it's Latin, like calum, which is essentially is potash. You know, if you burned food enough, you know, there's always that one member in your family that burns everything.
Hope you're not looking at me, husband.
Well, that sort of burnt remnant in the bottom of the pot, that's called potash, and it's potassium essentially. So it's called calum, and that's where potassium comes from, or the abbreviation K comes from. Potassium is one of those essential cations in your body. We talk about positively charged ions in the body, and the dominant cation inside cells is potassium. The dominant cation outside cells is sodium. And so when potassium levels rise, they rise in the blood, that would be considered to be a significant imbalance. So we get worried about very, very low potassium, hypokalemia, and very high potassium, hyperkalemia, when somebody has these conditions that causes issues with cardiac arrhythmia. So particularly the big, tall, tented T waves that you see with hyperkalemia. And if I want to bring somebody's potassium down very, very quickly, the drug of choice is insulin. So we give insulin to somebody to bring down potassium, because as we give them insulin, it drags, as you know, sugar into the cell, but it takes potassium with it out of the blood and into the cell. So an emergency management of somebody with an extremely high potassium is an insulin and glucose infusion to drag down their potassium. If we want to be a bit slower, we can use a drug called resonium. It's like a resin, resonium A, we can give to that patient, either orally or intramuscular. K, potassium. What?
I don't think you can say intramuscular.
But they know what I mean. In PR.
Yeah, PR is much better.
Public relations. I like intramuscular. Ketamine. There's another good K word. And we'll use this as one of our drugs. So ketamine. One of our drugs in the series I'm talking about. So ketamine is a medication that we've used for a long time. It's one of those drugs that we borrowed from veterinary science. It's been used in veterinary medicine for a lot longer than it's been used in people medicine, but ketamine is a dissociative anesthetic. So you know your brain is full of all different sorts of neurotransmitters, and you've heard of dopamine, and you've heard of serotonin, and you've heard of norepinephrine and oxytocin and all of these neurotransmitters. Well, there's a couple of neurotransmitters that probably don't get that much press. And one's called glutamate and the other's called NMDA. So it's N-methyl-D-aspartate is one of these neurotransmitters. And glutamate and NMDA are neurotransmitters that keep you here. You're present, you're listening, you're processing, you're perceiving, you're staying in the now, you have perception. And if you couldn't have that perception, if I blocked those receptors, then your thoughts and your consciousness would wander and may go to another place. We don't know where they go. A dream state, a state of meditation, but you dissociate from the now. And that's where ketamine comes into its own as a dissociative anesthetic. It helps a person in anesthesia to dissociate from the present state where they might be having, say, a painful procedure like a dressing done or a manipulation done or even a surgery done. Used by itself, sometimes as an adjunct for painful procedures, or used in association with other anesthetics that might be more sedative. Ketamine is a drug that really has sort of changed the game for us to be able to provide care to patients with fairly painful procedures without having to formally knock them out. Think of it as one of the agents that we might use in a twilight anesthetic. Really good for children. One of the big concerns with ketamine though, and that is, as a person emerges from a dose of ketamine, we need to keep a quiet, calm environment, because the emergence phenomena can cause quite awful night dreams, daydreams, or nightmares. As somebody is waking up from ketamine, noises and banging and clanging and alarms going off can be very overwhelming for that person as they're starting to emerge from that anesthetic. So a nice, calm, darkish, quiet area for recovery is required for people post-ketamine. Ketamine, big one. And our last K for the day is keloid. Keloid scarring. That's that over-proliferation of collagen in a scar. So you might have had some scar tissue, and as that scar tissue grows, sometimes it sort of hypertrophies. You get too much scar tissue, and it forms keloid scarring. Really noticeable on people with darker skin and more common in people with darker skin. Keloid. Okay, that's our 5Ks. See you tomorrow. Bye, guys.